Okay, but before I start, I'm going to check the patient's chart and make sure there's anything, check their primary diagnosis, make sure there's anything I need to know about, and then I will check the outside of the room, the doors, see if there's isolation precautions, flags, anything else I need to know about, and wear appropriate PPE. On the door. Hi, can I come in?
Mm-hmm.
Hi, my name is Claire. I'll be your nurse for today.
Hi.
Is that all right if I do a head-to-toe assessment on you?
Mm-hmm.
Okay, great. I'm going to perform hand hygiene, provide patient privacy, and I'm just going to ask your name, age, and date of birth.
Evan, 25, October 9th, 1996.
And last name?
Hockwell.
Perfect. So I've identified the patient, performed my hand hygiene, provided patient privacy, introduced myself, and at this point I would take a set of vital signs, and I'm just going to explain the procedure. So a head-to-toe assessment, I'm just basically going to take a look at you from head to toe, listen to your heart and your lungs, ask you some questions, just ask you anything pertinent that we should know about, and we'll go from there, okay?
Okay.
Great. And as I'm talking to him, I'm watching if his eyes are tracking me properly, if he's responding appropriately, if he has an appropriate attitude, color, skin integrity, and he seems to be alert and oriented. I'm just going to ask you a couple more questions. Where are you today?
In Seattle.
Okay, and what did you have for breakfast this morning?
Nothing.
And what is the year?
2021.
And who's the president?
Joe Biden.
Okay, patient is alert and oriented, ×3. And as I go through the assessment, as I check for skin integrity, skin color, temperature, also going to be checking for any wounds, lines, drains, IVs, catheters, any PICC lines, center lines, IVs, anything like that. And I'll also check to see if he's on oxygen or if he uses an incentive spirometer. Looks like he does not. And I'm going to start off with some general questions. Are you experiencing shortness of breath?
No.
Chest pain?
No.
Dizziness?
No.
Nausea or vomiting?
No.
Okay, none of that. That's great. And I'm just going to go ahead and I'm going to have you remove your glasses if that's all right. I'm just going to start by palpating the scalp and the head. Have you lean forward a little bit for me. Just palpating, making sure I don't hear any crepitus. And also, correction, before I would get started with any of that, I would ask the patient if he's in any pain. Are you in any pain right now?
No.
And if you were, I would go through the PQRST, provocation, quality, radiation, severity, and time. And if any pain comes up through the exam, just let me know.
Okay.
All right, so I'm going to assess the cranial nerves. Going to start with cranial nerve 2, 3, 4, and 6, the optic, ocular motor, trochlear, and abducens. Okay, and I'm going to have you look past my shoulder, okay? All right, patient's eyes are equal and reactive to light. I'm going to have you look at the pen light, look past my shoulder, and look back. Patient's eyes are accommodating. I'm going to have you follow the pen light with just your eyes, okay? Would you like to put your glasses back on? Okay, that's fine. All right. Patient's eyes are perla, and I'm just going to have you take off your glasses one more time. And I'm just going to inspect the conjunctiva. Look up for me. Okay, nice and pink color. You can put them back on. Cranial nerves 2, 3, 4, and 6 are intact. We're going to move on to facial nerves 5 and 7, facial and trigeminal. I'm just going to have you puff out your cheeks, raise your eyebrows, frown, and stick out your tongue. Okay, and that's facial and trigeminal. We're going to move on to cranial nerve 8, vestibulocochlear. I'm going to have you close your eyes for me, okay? Can you hear anything?
Yeah, right. Right. Left.
Okay, cranial nerve 8, vestibulocochlear is intact. And I'm going to move on to spinal accessory nerves. so I'm going to press against your face with my hand, and can you push against my hand for me? Thank you. And we'll do the other side. Okay, that's great. And I'm going to have you raise your shoulders against, perfect, that's good. Okay. And I'm going to test olfactory nerve number 1. Let's see here. I'm going to have you close your eyes for me. And can you smell anything?
Perfume.
Great. So cranial nerve, you can open your eyes again. Olfactory nerves intact, 2, 3, 4, and 6. Checked mouth nerves, I checked facial nerves, monocranial, vestibulocochlear. And I'm going to go ahead and inspect the oral mucosa. Can you open your eyes and say ah, or open your mouth and say ah? Thank you. And just checking the nasal mucosa while I'm there. Everything is a nice pink color. And gonna inspect the neck next. Can you face to your left for me? And face to the right. And here I'm inspecting for JVD on both sides. JVD is negative. Look straight ahead for me. Trachea is midline. And I'm just going to palpate the carotid artery one side at a time. Carotid arteries are strong, and I'm going to have you sit with your legs extended in front of you for me. All right, I'm going to have you grip onto my fingers with your 2 hands. Perfect. Pull out your fingers like this. Just checking all the fingers for capillary refill to see if it's under 2 seconds, which it is. And palpate radial pulses bilaterally. And I'm going to have you make this motion with your fingers. Okay, great. And I'm just going to have you close your eyes again. And tell me if you can feel anything.
Right arm upper, right arm lower, left hand, right arm upper, right leg upper, left leg lower, right foot upper, left foot.
Okay. And you can open your eyes. I'm just going to feel the back of my hand for temperature. Normal warm temperature, not too hot, not diaphoretic. And I'm going to move down to the feet. I'm going to straighten out your feet for me. Going to check for the Babinski reflex. And reflex is negative, patient is ticklish, and that is normal. I'm going to have you bring your feet a little bit closer for me. Just going to check the pedal pulses. Equal bilaterally. Checking the posterior tibial pulses. Those are also equal bilaterally present. Checking cap refill of the toes. Seeing those under 2 seconds. Checking for any edema or pitting. None is absent, or no edema is present. I'm going to have you push against my hands with your feet and pull against my hands. Great. Grip strength is intact. Sensations intact. And all right, I'm going to move on to specifically the cardiac system. So I'm going to expose the skin, inspect the chest for symmetry, skin integrity, color, symmetry of movement. Everything looks appropriate. And I'm going to palpate the chest for any crepitus, any pain. Do you feel any pain with that?
No.
Okay. I'm going to go ahead and auscultate, starting with the aortic valve, right of the sternal border, second intercostal space. Pulmonic valve, left of the sternal border, second intercostal space. Erb's point, left of the sternal border, third intercostal space. Tricuspid valve, fourth intercostal space, left of the sternal border. Going to go to the mitral valve, which is the point of maximal intensity, mid-clavicular line, fifth intercostal space. and I just listened to heart sounds S1 and S2, the diaphragm of my stethoscope. At this point, I would listen to heart sounds S3 and S4 with the bell of my stethoscope in the same places. Hopefully I won't hear anything upon that. And I'm going to move on to the respiratory system. So the respiratory system. Again, I'm going to expose the skin, check for skin integrity, color, temperature, all of that. I'm going to make sure that there is no accessory muscle usage. I've taken note of it. And I already palpated. So I'm going to have you take a nice deep breath whenever you feel my stethoscope, okay?
Okay.
I'm going to start with the left midclavicular line above the clavicle. Right side midclavicular line above the clavicle. Going down to right side midclavicular line, second intercostal space. Going to the left side, second intercostal space, midclavicular line. Going down to the fourth intercostal space, midclavicular line, left side. Going to the right side, midclavicular line, fourth intercostal space. Going down to the sixth intercostal space, midclavicular line, right side. And the left side, sixth intercostal space, midclavicular line. Going to the eighth intercostal space, mid-axillary line, left side. I'm going to have you lift up your arm a little bit for me. Knee right side, mid-axillary line, eighth intercostal space. Lung sounds are clear and equal to auscultation bilaterally. And I would note any abnormal lung sounds, any wheezing, any growls or crackles, anything like that. They are clear sounding. We move on to the abdomen. And before we move on to the abdomen, I'm going to ask you some general questions. Do you have any history of lung diseases?
No.
COPD,
No.
asthma, emphysema, anything
No.
like that?
No.
And how about heart diseases? History of heart
No.
attack, pacemakers,
No.
anything? Okay. And we're going to move on to the GI system, the abdomen. I'm just going to ask you about your bowel movements. Are you experiencing any constipation?
No.
Diarrhea?
No.
Are you experiencing regular bowel movements for you? Any dark, tarry looking,
No.
the appropriate color for you?
Mm-hmm.
Great. And while I'm just asking you questions, I'll ask about your urine. Are you urinating frequently?
Mm-hmm.
And are you urinating what you described as a pale yellow color?
Mm-hmm.
Any cloudiness?
No.
Any burning?
No.
Any urge like you can't make it to the
No.
bathroom before you go? Okay. And I'm just gonna I'm gonna have you scoot down in the bed a little bit flatter for me. Perfect. And I'd expose the skin, inspect, and go straight to auscultation. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. And I'm going to move to palpating. And do you experience any pain?
No.
Okay. Any pain, especially upon release?
No.
Okay.
No.
Any pain? Okay.
No.
And here I'm checking for rebound tenderness. My patient is not in any pain. And here I would palpate the bladder as indicated and inspect the perineal area as indicated and note any abnormal findings. All right. Just going through my checklist, making sure I'm hitting all my points. And I'm going to have you roll over onto your side. And at this point, I'm inspecting for skin integrity. especially any skin breakdown upon the bony prominences on the heels, the buttocks, backs, shoulder blades, anything like that. Noting skin color, temperature, any blanching, anything like that. And I'm going to have you sit up on the side of the bed if you're able to. I'm going to come around onto the back side, and I'm just going to note the general accessory muscle use. If there's any, there is none present. Symmetry of breathing, work of breathing. He is breathing easily, not with too much effort. And now I'm going to expose the back. I'm just going to palpating, making sure there's no pain in there.
No.
Right? Okay. So I'm going to listen to the posterior lung sounds, starting above the clavicle, mid-clavicular line. Oh, and take a deep breath whenever you feel my stethoscope, please. Second intercostal space, mid-clavicular line, left side. Second intercostal space, mid-clavicular line, right side. Moving down to the fourth intercostal space, mid-clavicular line, right side. Left side, mid-clavicular line, fourth intercostal space. Sixth intercostal space, left side, mid-clavicular line. Right side, sixth intercostal space, mid-clavicular line. And we've got eighth intercostal space, right side. Towards the mid-axillary, moving that direction. The lungs are equal, clear to auscultation bilaterally. I'm not hearing any abnormal lung sounds. And are you able to stand up?
Mm-hmm.
Okay, I'll have you stand up, face me, and close your eyes, please. Here I'm doing Romberg's test, checking for any swaying. Balance is good. Okay, you can open your eyes. Just gonna have you take a couple heel-to-toe steps for me. That's great. And you can go ahead and hop back in bed if you'd like. And just finishing up my assessment now, I'm just going to lower the bed down to its lowest position, reposition the client as comfortable. Is there anything I can get for you?
No.
Okay, I'm going to make sure that his highlight is within reach. Going to perform my hand hygiene. And let me know if there's anything else you need, okay?
Okay.
And I'm gonna close the door on the way out, perform hand hygiene, document my findings. That's it.